Hello, Dr. Cadena here. Today we're talking about Botox for aesthetic applications. You can use it for all kinds of stuff, from migraine headaches to bladder issues to plantar fasciitis, but most people use it for aesthetics or to try to maintain the skin youthful without wrinkles. So in my prior video, I thought I had done it in English, but it was done in Spanish. You may not understand it, but you can see the movement of Veronica, the model's face. She tends to form a lot of wrinkling across the forehead. And so in that video, we were showing you how you can form wrinkles here in your forehead and the crow's feet around the eyes. And so we use Botox to temporarily flatten out those wrinkles by causing a temporary basic paralysis of the muscle. When you first start doing Botox, it might last about 4 months, and the more that you use it, it kind of becomes cumulative in the skin, and it's not completely worn off, so that when you apply the new Botox, you'll get closer to 6 months the more that you use it. So I'm going to show you Veronica's face after we applied it maybe about 2 weeks ago. So around day 14 you get the maximum effect of Botox. Okay, so here's a supermodel, Veronica, and so she usually forms a lot of forehead wrinkles. This muscle is called the frontalis. It has two bellies, basically one big one over here and one on the other side. And so when people are worried a lot or they're frightened or something, then they tend to raise their eyebrows and form those wrinkles that go across the forehead. And then here in the middle is a muscle called the procerus. And then on the over here is called the corrugator. So when people use those muscles, then they tend to frown and they form that deep wrinkle in between the eyes. And then you have a big circular muscle that goes around the eye. It's called the orbicularis, and when people smile, they form what's called the crow's feet. And so that's the main areas that we typically apply Botox to prevent the onset of wrinkles. So it's preventative. So the younger that you start using it, then as you age, you'll form less wrinkles, and once you have wrinkles, then it helps to flatten out the wrinkles. Once the wrinkle is deep, like let's say your seats in the car, you buy your car, it's brand new, the leather seats are smooth, and over time you form wrinkles. So if you form deep wrinkles, then you have to use other technology that we have called Votiva and Fractora to basically remodel the collagen. That's a little bit more work, but we use that on the face and neck to take about 10 years off someone's face. We have videos on that already. So anyways, Veronica's going to demonstrate flexing the frontalis muscle after having Botox. So that's the forehead wrinkles. So she's really trying to flex that muscle, and it's pretty smooth compared to what it was before. I don't like to go too far out. Some people put a lot over here. Just relax. And so some people like to raise the eyebrow, but to me it doesn't look very natural. So I don't really like messing with that unless someone really asks for it. I like to maintain a little movement here lateral, so that when you're out in public around your friends or whatever, your face isn't frozen like a cat, and you still have some movement in the face, and people usually can't even tell that you're having Botox applied. So Veronica is going to demonstrate how she still has movement laterally in the face. So go up, down, up, down, up, good, down. So there's still movement. So it doesn't look like your face is completely paralyzed like a cat, okay? And she's going to demonstrate being angry. She's never angry, but she's trying to be angry now. Angry, angry, angry. And so that central area in between the eyes, there's no wrinkle that's forming there, okay? And then she's always smiling. So here she's trying to really smile really big, and really it's very minimal. She usually has these deep crow's feet lines, and she's trying to make those happen, and she just can't do it. And on this side also, right at the corner of the eye, typically there's deep wrinkles. So that's an example. You can compare it to the first video. Sorry, it's just in Spanish, but I can't go back and do it right now because Veronica has the effects of the Botox. So when you look at her in general, what's your age?
48.
So she's 48. She has nice skin. We've made her have a more youthful appearance, not having the wrinkles that most people are forming at 48 years of age. We haven't done the other Votiva and Fractura on her. She's liked the effects of the Botox and is happy with that. But if she wants to start to kind of improve the skin texture, lean your head back, of the neck, women tend to start forming horizontal lines in the neck from time and using it. So we use the Votiva and Fractura to remodel the collagen underneath the neck. But we also use it all over the face to remodel the collagen and tighten things up. But basically this video was just to demonstrate the before and after of Botox cosmetic application to the face. Again, if you have questions, just put them down below and I'll do my best to answer them. And thanks again for watching the channel.